Hello everybody to the 8th installment of the Transform Education series, where we help you transform your practice, patients, and healthcare by adding functional medicine services based on how your patients are adapting to stress. I'm your host, Pete Wisniewski, and our group of world-class educators are excited that so many of you are contributing feedback, watching the replays, and participating at our events. In case you missed any of these sessions, you can easily find the replays and notes to follow along at transformwellness.org. As you listen to the content and think of somebody who might benefit from it, please don't hesitate to post it on Facebook or email your friend a link to the replays on our website. Today, Dr. Schipper is joining us for the third webinar in her blood sugar balance series. It goes without saying that Dr. Schipper is energetic, dynamic, and a true blood sugar expert, having helped hundreds of patients manage their blood sugar levels. I want to personally thank Dr. Schipper for taking time out of her busy day to be with us, away from her practice in Jacksonville, Illinois. Dr. Schipper just finished teaching a weekend seminar here in Chicago, which was a lot of fun. If she's in your area, please don't hesitate to register. You'll be glad you did. Now, without further ado, let's listen to Dr. Schipper finish up her series on blood sugar disarrangement. Welcome to Transform Wellness, Dr. Schipper.
Thanks, Pete. Today's webinar topic, chronic stress equals chronic blood sugar issues, is to wrap up this three-part webinar series. We've gone through a few things to look at some signs and symptoms that our patient might complain about, and then also looking at blood lab values. So I will take a short moment, not a lot of time, but just to review some of those flags and ways to view it. But more importantly, talk about what is the support we can give this particular patient, how we can start with them, how do we follow up with them, and what makes sense, like what would we want to do next. So hopefully that this will be a nice wrap up for everyone, and of course we'll have some time for some Q&A at the very end as well. So first of all, the topic is about chronic stress and chronic blood sugar, and I wanted to bring in that stress has its own impact in affecting our blood sugar as well. So when we think about how do we deal with stress, we need to recognize that when we're under stress, different organs create hormones that communicate with each other and also communicate within the body because of the stress. And these glands perform different functions to help adapt to our environment and different lifestyle choices. The hormones in particular is what's going to affect our blood sugar balance. And that was one of the things that I really wanted to bring home, was looking at if we have some stress and we produce some hormones, what's impacted? What are the glands impacted and what are those hormones? And ultimately, all of this communication happens via the HP axis or the hypothalamus pituitary axis. The glands that we're talking about that maybe don't work so well when they become tired and the communication becomes disrupted. So we're looking at it. We have the adrenals, we have the pancreas, we have the liver, and we even have the thyroid that plays a role in this. And any stress requires a response. Any stress requires a response by the body, physical, mental, or environmental. And the key hormones that are involved, of course, is cortisol, insulin, and our thyroid hormones. And what's important here is to also recognize that these hormones interact with each other. So for instance, cortisol, one of our stress handling hormones, it's produced by the adrenal glands. It's our most potent anti-inflammatory hormone. But if it stays elevated or stays high, not only does it bring blood sugar up, as we've talked about in the past, but it will antagonize the function of insulin, making it so that insulin doesn't work as effectively. Then we have liver, which the job of liver, just to put it simply, is to clear out all these excess hormones and to also play its role in managing our blood sugar as well. And so you can see how it can fit in there. And then the thyroid, whether the thyroid is hypoactive or hyperactive, will also influence our blood sugar. And it allows us to appreciate that when it comes to these issues is not to consider only just the pancreas. It's got to only be the gland that produces insulin, that there are actually other factors that can interact and play a role in our blood sugar regulation and certainly stress. So what causes our glands to become tired? I know for many of us, we can go, oh, yeah, I totally get this. But we want to think about this for our patients as well, and that stress comes in many forms. And some forms of stress, which I definitely think are the emotional, the mental part, has a lot to do with perception. But then there are other stressors that are very real. They're physical, they're chemical, they can be nutritional, traumatic, and so forth. So what we want to do is take a full look at what can affect it. And here's just a brief overview, reminding us of what the physical aspects are, what's chemical, certainly the mental, the emotional, but even nutritional, not having enough, not being able to nourish our entire body, let alone our endocrine system. Then we can have the traumatic stressors that can cause us to become exhausted, especially if we're constantly injured or we're not being able to resolve that issue. And certainly, last but not least, the psycho or spiritual. And that really is I do believe that's another aspect of the emotional component to it. But we do want to recognize, one, what our patients are going through, but also allow them to see that stress comes in many forms, because sometimes they see it as only one, like, oh, I'm really happy in my job, or, oh, I have a really happy relationship. But then you realize they're eating fast food, they're getting, 3-4 hours of sleep at night, which really just isn't sufficient. So to briefly look at, what happens to the organs. So when the pancreas becomes tired, here are some key comments that they might complain about, or we could ask them to just kind of get a window into what's going on. Are they having sugar cravings? Are they seeing undigested vegetable matter in the stool, or just incomplete digestion? Because we have to remember that the pancreas also produces lots of enzymes that are necessary for digestion besides insulin. Do they have compromised energy production? Frequent urination, a really good indicator of early signs of what I would call functional insulin resistance, or sleepiness after eating, just more tired after they eat. When the liver becomes overburdened, we might see these comments, or we might notice them ourselves, or we could ask the patient about it. Are they showing poor skin health? Think about eczema, psoriasis, even acne, cystic issues that are going on. What about poor vascular integrity? Easy bruising, bloating, or right side liver pain. They might even have referral pain into the shoulder blades. That's pretty common as gallbladder symptomology going there. Floating fat particles in the toilet water, light colored stool, constipation, and sometimes that can vary with looser stools, but more typically is if the bile gets more congested and the liver becomes more sluggish, then we're going to more likely see the constipation. But I would say be aware of any alteration in bowel movements in general. But remember, the liver has to clear out all these excess hormones, excess toxins, and so forth. So it does become an integral part of our healthy system, and certainly blood sugar. And the adrenals. Some of our top statements or questions we might be asking them about or looking for them to respond about is, feeling dizzy when they go from sitting to standing quickly. Extreme hunger between meals. Sometimes we call this hangry, they're angry and hungry at the same time. Fatigue that's relieved by eating is more hypoglycemic, but if they have fatigue that's worse after eating, that's hyperglycemic. And again, those are early signs of functional insulin resistance. They can also have more salt cravings, sugar cravings. You might see more of that central weight gain. And part of that central weight gain can also be because of the cortisol and the cortisol impact on insulin. We'll see that weight gain right around the abdominal area as well. So these are just some reminders of some of the clues that we can look at and we can ask them about. And it does help us to remember even the component of stress, right? Stress from not eating at appropriate times or not choosing the right food, overburdening the liver, overburdening the pancreas. Now, I did say early on that this is regulated by the HPA axis, and it can be viewed in a couple different ways, especially when we're looking at stress. So we might see the HPA axis hyperactivity, and with that, we're going to see increased cortisol, decreasing progesterone, and that's because that's one of the precursors to making cortisol. The negative feedback is not working. So instead of shutting down, it's staying going, it's staying hyper. So the cortisol message is not being received by the pituitary. We can see higher insulin, higher blood sugar. And of course, with higher cortisol, we'll have increased reverse T3, which will result in lower free T3 values. And that is where you can see that thyroid component come into play as well. We can also have HPA axis hypoactivity. And of course, this is going to happen as the gland becomes more tired. And, it's a normal response to, go to the call of stress, right? Normal response is like, we're going to gear up and we're going to go to whatever that stress is, cortisol to the rescue. But over time, it's not going to be able to keep that up, and we're going to see that increased exhaustion and that hypoactivity. More commonly with that, you're going to see decreased cortisol, decreased progesterone. A negative feedback's too strong. The cortisol message is not received by the pituitary. You might have low blood sugar issues at this point, and that's because cortisol and blood sugar go together. The shutoff mechanism can be overly sensitive to cortisol, and we might be having an HPA axis that looks and feels more depleted. And not to make this more complicated, but to help you understand how the body kind of rolls with this, usually what happens, or what I typically see in clinic, if I'm actually measuring cortisol, a cortisol rhythm throughout the day, I can see highs and lows. Like I might see a low cortisol early in the morning, then it surges up, and then it goes down to a depressed value again, and it may surge up at night, almost as if there's a roller coaster going on. And I find that pretty typical that, at first you might just see that high end or higher cortisol, and then you start to see this abnormal of highs and lows until you see a pattern that looks more depleted. And what you just have to keep in mind, the lab test is one way to view it, to take it back to the patient. It's a very good visual, and we will remind you of the blood lab values as well next. But it's always within correlation of their own presentation. How are they presenting with their symptoms? What are their chief complaints? How do they appear physically? And you use all of that together to give the most complete picture of what you've got going on with the patient to make the best recommendations and how to go forward working with them. Just a little reminder then about the blood lab values. Now, it's kind of like what I just said about the cortisol, where you can have the highs and lows. Well, even with the blood lab values, you won't necessarily have all of these show up at the same time, but any one of them out of this ideal range is an early indicator. So if you happen to be the doctor that is looking at blood lab values, this is going to be really important to you. Or maybe if you haven't been doing it very much, but the patient comes in with them, you can look at these 6 and start having that conversation, and maybe ask them questions about how they're feeling. Go back to those symptoms that we already mentioned that you can see on an endocrine balance survey that will tell you a little bit more about it. So of course, if fasting glucose is greater than 100, we might also see a hemoglobin A1C greater than 6.7. Now, the hemoglobin A1C, remember, is a 3-month window. And I've actually seen fasting glucose on that day of test be less than 100, but I have a hemoglobin A1C, at the very least in that pre-diabetic range, in that 5.8 to 6.7 range, which should get our attention as well. We have uric acid greater than 5.9. Remember, that is a definitive correlation, that goes with type 2 diabetes, is elevated uric acid. If we have elevated triglycerides, greater than 130, 140, we're going to see that's a reflection into the liver. The liver is storing these sugars now known as fats, triglycerides, because it's not being handled by the pancreas. And one of those that we want to think of, both with the triglycerides and the uric acid, if they're up, is going to look at a diet that's high in fructose or high fructose type foods. And, that can be also very damaging. Really low HDLs. And, I'm going to say below 40. But you might go, well, HDLs, that's a heart risk. Well, think about it from this point too. HDLs, to have healthy HDL levels, is significantly tied to magnesium. And magnesium as a mineral is necessary for our blood sugar metabolism. And that's how it can be one of our other markers. And then last, of course, but not least, is alkaline phosphatase. Now, alkaline phosphatase is a zinc-dependent enzyme needed for it. And if it's less than 70, then that's giving us an early sign of a zinc deficiency. And while zinc deficiency is related to insulin issues, but also keep in mind how important of a role it plays in the entire endocrine system. It has a role into hormone function, immune function, thyroid function, and so forth. But these are nice because they can give you a reference to come back into this to remind you of what the key factors are. And of course, I did talk about this in the previous webinar. Okay, so what needs to change? What do we need to do? Obviously we have to have the dietary changes, and we need to be reminded of what the red flags are and to give the simple starting points for our patients. And we know we need to have appropriate exercise. Too little is just as much of a problem as too much. And oftentimes you're going to see this patient where especially if they're frustrated with the weight, oftentimes you're going to find that they're over-exercising, feeding the inflammation, disrupting the blood sugar regulation, and then they're just really not getting anywhere. So it is important to look at the appropriate exercise. And those of you that followed through with Dr. Bill Hemmer and how he was looking at these different markers, you'll be reminded of those evaluation tools that can show us what kind of exercise our patient should be doing right now. And stress management. You cannot, no pun intended, stress this enough, but how they are handling stress, how they view it, their perception of it, both the perception that I think is good and bad. So there is a healthy perception about stress and what we need to do and wrapping our mind around it and feeling good about it. And then sometimes I see the people who, they're walking in and if you ask them, they have no stress, but you're looking at them physically going, okay, buddy, there is definitely some stress going on. So the conversation might be a little bit different with that particular patient, and they might respond more to the statement of feeling overwhelmed necessarily than feeling stressed. So just a nice thing to keep in mind, but it is important that they find ways to manage stress. They find ways to do things for themselves, to feel good, feel happy. These are what we call our lifestyle modifications, taking a walk, reading a book, going to the movies, anything that makes them feel good, feel happy. And what I want to talk about today, and I know you guys have been chomping at the bit about, which is, the proper nutritional and herbal support. How do we support these glands? How do we reduce the inflammation? How do we support the stress response? How do we feed the body in a way that it can adapt appropriately so that we don't stay in these stages of huge hormonal swings or imbalances? Now, some of the dietary ones, and I'm going to, each slide's going to go into a little bit more detail, but you can ask them, do you find yourself, reaching for that coffee or the soda because you're tired? You got to have it. You're looking for that pick me up. And, a reminder of what excess, caffeine does to the body. And we're not talking about the person who has 1 cup of coffee, but what about the person that's living on the pot of coffee or doing those high energy drinks, or maybe the sodas that are not only full of sugar, but they're also full of caffeine, and, be able to have that conversation with them. It's interesting. I've watched where some people in my practice, I've had the ones who completely cut out the caffeine and they feel better. Like they actually have more energy once they've gone 3 to 4 weeks without caffeine. And it's kind of funny because you're like, well, why were you doing it in the first place? But they were dependent on it. And then you're going to have that other group that will come back and go, I'm okay without it. It didn't, but I just miss it. And that might have been the group that only had a cup of coffee a day, not the double shot latte with triple syrup added into it. The type I'm talking about, the kind that has a little bit of coffee with their milk and sugar. Or they're relying on the caffeine drinks that are full of sugar and triple the amount of caffeine. that you would have in a cup of coffee. But it is cool because those that have more energy afterwards and really notice the difference, you know that they were relying on it and it was causing these problems that we're looking at, versus the person who maybe just says, it's that warm cup of coffee makes me feel happy and I can take it or leave it, but I prefer to take it. Just a way to think about it. Now, craving the foods that are high in sugar. Do they give you energy and make you feel good? It's kind of a trick question. Typically it's gonna result in a sugar high followed by a sugar drop, and with that goes mood and energy. So mood and energy may feel up when they're on the sugar high, and then mood and energy bottoms out when they drop. But what's tougher about this is that they are highly addictive. And I know I've mentioned this before in other webinars, but sugar is actually more addictive than cocaine in the brain. And I don't think that can be stressed enough. And when we consider that the average adult should have somewhere between 26 and 35 grams of sugar per day, and yet the average is having somewhere around 90 grams of sugar per day and higher, we've got a problem. We've got a problem on our hands. And most processed foods are high in fructose. And keep in mind, fructose can only be metabolized by the liver. And that's a double whammy because fructose increases the sugar cravings. It also bypasses the pancreas. So it's sort of this full, but the minute it comes into your mouth, what does your body do? It gears up for it, thinks, oh my God, I got all this sugar coming in. And yet it's not. And so it's one of the culprits definitely behind the fat storage, the fatty liver, the stress to the liver, and the high triglycerides. That's really just a patient awareness, I think, of looking at the processed foods. Because when you have a piece of fruit, which also has fructose in it, it also has fiber in it. And remember I said that Dr. Listwick said that, fiber is nature's antidote to fructose. So it is, again, very different things what we're looking at here. Now, what about the emotional component? Feeling anxious, nervous, or depressed? And again, these are some questions that you can ask your patient and looking at, okay, what about negative responses to stressors and talking to them about how to find a way to feel better about it. I mean, if you're sitting in traffic because there's an accident, what are you going to do? Really? There's nothing you can do, and getting more upset and anxious about it is obviously not a good idea. And it takes practice. It's not an easy thing to just, flip that switch off, but they have to understand that how they feel and how they're responding emotionally will also affect their hormones, which is also going to affect their overall health. So this just gives us another reminder to look at that. And it really is important. And it's unrealistic to tell people have no stress. We're always going to have stress, but it's about our response to stress and learning how to manage it that really is the key to our overall health and vitality. Okay, so now a diet and supplement plan. So there's a couple things that we can look at here. Diet, we're really talking to them, are they doing simple refined foods, or are they doing more complex carbs, more real food? That's probably the most basic way to look at it. Clean protein, good quality protein, good fats, clean fats. That means if we're doing fats from animals, it needs to be organic and free range, no exceptions, whenever possible. And we want organic everywhere. But I think that starting off is just getting them off of the refined, heavily processed foods. Supplements. We want to target the most stressed glands and use supplements that are highly bioavailable and easy for the body to assimilate. Utilizing herbs. We're going to talk about some of the herbs that have a profound effect on healing the body, both from what we'll talk about adaptogenic, restorative, or a tonic property that is really nice for them. Teas, maybe for that person that wants something hot, look at utilizing teas more. Green tea has so many healthful benefits for the body and the hormones in the body. We would want everybody drinking that, and they're not overly stimulating. And we can also look at calming teas that have chamomile and ginger in it that are so good for our digestive system as well. So for the pancreas and liver support, there's some key ones to think about. Some of my top favorites: gymnema, milk thistle, turmeric, and then we could also look at, in a general support, multi-gland support, whole food B complexes. The B vitamins are really necessary for the whole endocrine system to function well. We also need good vitamin C, and in particular the minerals zinc, magnesium, and chromium. And many people always think of chromium when it comes to blood sugar, but zinc and magnesium are just as important when it comes to that. And wherever possible, a lactate or chelated form of these minerals is going to be ideal, and they're going to be the most bioavailable. And we can look at certain labs that we can track. We can look at AST and ALT. That's liver enzymes are outside the liver for AST, hemoglobin A1C, insulin, fasting glucose, and triglycerides. Now, having said that, I want to loop back around, and I want to talk about some of the herbs for just a minute, because I know most people can get like the whole food B complex, you think minerals and so forth, and maybe you've been using those for a while and been a little bit stuck. But gymnema is one of the oldest herbs when it comes to supporting normal blood sugar levels. And gymnema has some research to suggest that it's actually showing restoration of the pancreatic beta cells. And this has a profound implication and impact for the health of our patients with blood sugar issues. But gymnema also helps normalize lipids. It helps balance that cholesterol profile, normalize HDL and LDL. It supports the pancreas. It helps normalize blood sugar levels when it's added to a healthy diet. You got to have a good diet with all of these. These herbs are not going to be able to overcome a poor diet. And we find that when we utilize gymnema at higher doses, not only does it curb the sugar cravings, but it can also curb the appetite. And that leads me to believe that what we'll find as the years go by, I believe with the research, is maybe there's some influence with leptin and ghrelin as well. But we know for sure that, it does have a tremendous benefit to balancing blood sugar with a healthy diet and its support for the pancreas. Now, milk thistle and turmeric, I'm going to pull those together because both of those are key liver supports. And by the nature of supporting that liver, they're also going to have an impact on the blood sugar as well. Now, where I'm going to separate the two is that milk thistle has been shown to be trophorestorative or hepatorestorative, actually helps heal the liver, which is tremendous for someone who's had, maybe more significant liver conditions or been told they have a fatty liver, if you will, but to really have that good liver support to make sure that the detoxification pathways are intact and also the liver's ability to get rid of, the excess hormones, properly produce bile and, break down fats and so forth. Turmeric is a liver support, and there's a lot of research that's been going around in the last year. I've seen it all over the place about its impact on blood sugar as well and supporting normal levels. But what I also like about turmeric, it's a great anti-inflammatory herb, which means that if there's ongoing chronic inflammation in the body, chronic stress, maybe from that, turmeric can really help balance a proper inflammatory response, pulling the body more towards an anti-inflammatory state when it's necessary. So it's just some really, really amazing things that we can see with these herbs. Now, the next two, I'm going to look at adrenal. We're going to look at adrenal adaptogens and also adrenal tonics. And to understand what an adaptogen is, very simply means adapt to stress, have the appropriate stress response. It's not about not having a response to stress, because that's not realistic. It's about having a response and then coming back to what I would maybe call baseline allostasis afterwards. It's to keep us from staying in that fight or flight or that stressed out response. And that's what an adaptogen is. An adaptogen is to support our body's adaptation to our environment. And some of the key ones I want you guys to consider is certainly rhodiola. And some of these you're going to see in the next slide too. But rhodiola is a wonderful, wonderful herb. not only does it help our body adapt to stress, it can help balance cortisol. It also balances mood, which is a really fantastic aspect of it. We have Schizandra, which is also considered an adaptogenic herb. What's unique about Schizandra is that it can have some influence into the liver as well, liver detox pathways. And it also supports endurance and clarity and focus of our mind. Now, ashwagandha is one of my favorite herbs in this category because of what we talk about, which is the thyroid and adrenal connection that can also tie into what goes on with the liver and the pancreas. And ashwagandha, as an adaptogenic herb, can help balance cortisol, can help support the appropriate stress response, but it also supports thyroid. It supports normal TSH, and it supports the conversion of free T4 to free T3. And I love that idea of an herb that can do so many different things. And this is good to think about, because what if the person that, you're seeing, you're going, wow, I know there's some blood sugar issues and I know that there's some adrenal issues, but my gosh, she has all of these thyroid, or he has all these thyroid indicators. That should allow you to choose, or think about at least, ashwagandha. If you're thinking more adrenal, more liver, blood sugar, maybe foggy thinking, so forth, then you might consider rhodiola and Schizandra, just as an example. And now eleuthero is one of those herbs that's primarily an adaptogen, where some of our other herbs will have some other properties with it. But eleuthero as an adaptogen is it's a wonderful herb, I think, to improve endurance and also clarity of thinking. I also think of eleuthero more for the person who is more depleted. Whereas, remember I was talking about, so if you're thinking more like if you were doing the testing more of a low cortisol profile, I tend to lean towards eleuthero. If they're sort of up and down, they kind of have like low cortisol, then goes up, and even their mood and energy is up and down, then I'm going to lean more towards ashwagandha or possibly rhodiola, just to kind of give you an idea about those and how you would want to look at it. And again, just like with the other ones, you still want to include the B vitamins, but we might want to also give more consideration to whole food vitamin A and C, and also utilizing things like buckwheat that has rutin in it. But in particular, vitamin C. Vitamin C is a key one for adrenal health, because the adrenal gland is the largest storage site for vitamin C in the body. And so obviously it needs it to also function healthy as well. Now, our adrenal tonics. Now, these are adrenal tonics, but some of these you might see as a body tonic as well. But this is about strengthening a gland, strengthening a system. So you might have a whole body strengthener, and then we can also have an adrenal tonic to make that, especially the part of the adrenal gland that produces cortisol and DHEA, progesterone, testosterone, estrogen to a lesser degree, is the adrenal cortex. And the key herbs that we'd want to think about there is licorice, rhamania, rhodiola, Korean ginseng, and of course anything that is a whole food adrenal formula. Looking at, again, something that is complete in its context of B vitamins and vitamin C that will support a healthy adrenal gland as well. But our tonics, some of the top tonics, many of you've probably heard before, is like licorice and rhamania. Those are going to strengthen the adrenal cortex. Licorice also has a lot of support into blood sugar regulation. It's naturally anti-inflammatory. It's soothing to the GI tract, can help with mild constipation. Rhamania is also known to be an anti-inflammatory herb, so it can take the heat out, but also has some properties to support liver and kidney as well, and those pathways. Now you'll notice that rhodiola is here again. Rhodiola, actually one of my favorite herbs, because it acts both as a tonic and an adaptogen, and it does it very, very, very well. So we have that benefit of adapting to stress, but we have the tonic benefit, which is going to improve the strength of the gland itself, and certainly the adrenal cortex. And Korean ginseng is, some people think of it as a whole body tonic, but even if we want to put it into that category as a whole body tonic, it's also going to support the adrenals as well. And what I like about Korean ginseng, it has research to show that it also supports blood sugar regulation or normal blood sugar values. And And there's just lots of research behind that one, and it pairs really well with rhodiola in combination together. So it's kind of nice to think about, sometimes with these herbs to think about what can we pair together or even use on its own and what will give us the most for what we're looking for. You have to think about what the patient presents with and what's the action, what are you trying to achieve, and then choose your support from there. How we can look at the need for adrenal tonics, fasting blood glucose. Is it really low or is it really high? Either one can be an adrenal issue and the adrenal cortex. Looking at cortisol again, insulin, and actually both sodium and potassium. Sodium and potassium as minerals really tie into adrenal function overall. Next, we're going to look at essential fatty acids, and this is your good fats. They're absolutely essential to life, which is hence the name, essential fatty acids, and we have to get them in through our diet. We cannot make enough of them on our own, so they have to come in through our diet. Plants and deep sea fish source is the preferred choice of our essential fatty acids. Again, it's making sure that it's clean, that there's no toxins, no chemicals, and so forth. But our essential fatty acids, our EFAs, improve insulin sensitivity and also all hormone sensitivity or hormone receptors. And that is so important because as someone becomes more, as we call, insulin resistant, even in that pre-diabetic state, if we can improve those receptors, improve that sensitivity, then the insulin is going to work better. The hormones are going to be more effective. And just by the nature of that, we're going to create better balance in the body. So we don't want to underestimate the importance of the essential fatty acids, but I do think it's really key here to make sure that they're getting high quality and that, you're not just saying, oh, go get some essential fatty acids, but making sure that they're getting good quality essential fatty acids. And we can also look at certain plants are going to be high in the fat known as GLA or gamma-linolenic acid. And this can also help with if there's some chronic inflammation that's feeding into the chronic stress and the chronic blood sugar issues. GLAs help modulate the prostaglandin response, which means they help push the body more towards an anti-inflammatory response if it's been in a chronic state of inflammation. And I just think that that's really important. One of my favorites as far as being high in GLAs is black currant seed oil, but you could also consider evening primrose oil. And then some other good fats would be tuna oil or cod liver oil. But we just need to keep in mind that depending on the complexity of the case or how the patient presents, depends on your choice of supplements. Do you have a whole food complex multivitamin that's going to meet their needs with the minerals and the B vitamins and the vitamin C? Or do we need some complexes there as well for a short time? And utilizing the herbs with that will give you the best results, and looking at the tonics and the adaptogens. And if you're unsure, you can pick something that does both. We could certainly look at, in particular, rhodiola that acts both as a tonic and an adaptogen, and then go, okay, do I need more liver mood support and focus and attention? Then I'm going to pick Schizandra maybe to pair with my rhodiola. If I was looking more for whole body support, maybe more blood sugar, I might choose Korean ginseng. And it's really just thinking about it in that way that allows us to make a really good decision. Or we might look at utilizing, say, licorice and ashwagandha paired together for a good adrenal thyroid support. Just ways that we want. It's not that hard. I know I'm not trying to make it sound difficult, but it makes it more fun actually if you just kind of think about, okay, well, what do they got going on, and what do I see and what do I want to do? And in this is so important that you work within a 90-day cycle minimum. I mean, I think our goal is obviously to have a patient for a lifetime. And certainly when I'm working with difficult patients or patients that are coming in with some of these issues, I want them at least to mentally wrap their mind around spending at least 6 months with me. But I break it down into this 90-day cycle or this 3-month commitment, because you got to have enough time to see some changes and to see some results. And especially if you're dealing with already red flags or markers with the blood sugar, that is a 3-month window. If you consider just the hemoglobin A1C as a 3-month window. So we need that time, to create that shift. It doesn't mean that it's going to take 3 months for them to feel better, but it may take 3 months for you to see significant results for them to go, oh, wow, not only do I feel better, but look at my numbers, look how much better I'm doing, or I've actually started to lose some weight, or I'm actually find that I'm not so irritable with everybody and I actually have more patience. Whatever it is, you've got to have that time to do it. This is not a quick fix. This does not happen overnight. If they come into you with a lot of bad habits, a lot of bad dietary habits, and they're not even walking, and yet, they're getting angry at everything, you need even the time for the behavior change. And, here's the best part. When they are successful, and they're seeing it, and trust me, they see it early on. They're going to start to see it and feel it early on. They will start sending you all sorts of referrals. They will send other people to you, and they'll be telling everybody about you because, people, when they feel good, especially if they felt bad for a long time, they want everybody to know. And not only that, even if they're kind of quiet, when people notice a difference, they'll be like, what are you doing? Who are you seeing? And there's just, honestly, there's no better feeling than to have a patient referral, because that means that we're doing exactly what we set out to do. And that was to help someone feel better and have a better quality of life. So thank you guys. Thank you for being in with me on this is number 3. And so we'll take any questions, any concerns you have, and we'll wrap this up. Thank you so much.
Thanks so much, Dr. Schipper, for your 3-part series on blood sugar balance. For those of you looking to grow your practice by helping your blood sugar patients, I welcome you to write down Dr. Schipper's office number at 217-245-9797 and set up a time to schedule a one-on-one case review session. Dr. Schipper helps practitioners from all over the country consult on cases in order to grow their practice. On your one-on-one session, she can help you with lab testing interpretation, and if further testing is needed, help choose which supplements and herbs will work best, help with lifestyle recommendations, and coach you through navigating functional endocrinology. Again, call Dr. Schipper's assistant at 217-245-9797 to schedule a case review time for your toughest cases. Before we get to the questions, please take a minute to note down the upcoming webinars by Dr. Rhonda Nelson, Dr. Bill Hemmer, and Dr. Annette Schippel as we continue our look into practice management, blood sugar, and thyroid stress. Please join us for the next webinar on Thursday, October 15th with Dr. Rhonda Nelson and her presentation, Top 10 Thyroid Tests Every Functional Medicine Doctor Must Know, where she will show us how she evaluates a thyroid blood panel. Now, be sure to type in your question in the chat window to the right, and we will do our best to answer them in the time we have left.